Hi, everybody. This is Lee, and I'm talking about healthcare, which I do a lot because it's a serious issue. It can make or break an executive administration, right, Theresa May? It can make or break your executive administration. And so, right now, we see that healthcare is a concern here in the United States. It affects everyone because none of us are 100% perfect. There was maybe one perfect man on earth who provided health care to all. He healed the sick. But the rest of us, much as we try and strive to be that person, we are ourselves. And so we need health care. And so I'm looking at John Conyers' HR 676 bill, which is up to 115 co-sponsors. It's currently in the House in committee. And hopefully it has not been sent to committee to perish as some other bills have been sent. I think it's made it through 3 committees so far. And so I said, okay, Bernie, anytime you're ready. We certainly are. And, he's been going to, and I'm like, is he teasing us? What is he doing? I mean, he's like, I'm going to introduce this. And in the time that he's been saying that, we've seen, of course, John Conyers, his bill get introduced. And then we've certainly seen Paul Ryan and Mitch McConnell trying to get their efforts through. And I'm like, okay, there's healthcare bills going through Congress. Bernie, you're up. And I said, oh my God, I think Bernie wants us to beg for it. I don't know what he's trying to do. But anyway, I said, okay, we hear from Bernie Sanders, like, well, let's do, a type of universal health care. Health care is a right. We can lower the Medicare age to 55. We can possibly do a public option. Well, maybe we can just work our way up to it, Medicare for all, or maybe we know what we need to do is protect Obamacare. And so we've heard just about everything from Bernie Sanders. I mean, we've seen a lot of talk. We see, where he says he's going to, but we don't see where, he says that, okay, I've done it. All right, shut up. There's my bill. And so what can we do? And so I said, well, I'm going to look to see what he's done in the past, the bill that he introduced, and try to see what he's thinking about, because he's been all over the place, and I don't get that. But anyway, it's S-1782, American Health Security Act of 2013. And so this bill, December 2013, the 113th Congress, which is 2013 to 2014, the year before he declared his run for president, he introduced this. It went to the Senate Finance Committee. It was read twice, and then referred to the Committee on Finance, and then nothing. No co-sponsors, no vote, nothing. It just went to that committee, and then nothing happened. And then the beat went on. And so for the 114th Congress, which was during Bernie Sanders' run for president, 2015 and 2016, he did not introduce that bill. And I kind of wonder why. And I wonder where we would be right now if he had introduced that into the 114th Congress while he had the national stage. Before, he was one of 100 senators, and maybe there were like a lot of things going on, and it got barely any notice. But while he had the national stage and access to media, access to the North American public, what would have happened if he had brought that bill on the road with him and said, look, I've got this bill. It's in the Senate right now. Let's talk about it at this town hall, that town hall, this debate, that debate, and, where would we be? But, we look forward. And so it was not introduced, and it was not introduced into the 115th Congress yet. And so, again, what do we, anytime you're ready. Okay. But you know what? Let's see what Bernie Sanders may reintroduce back into the Senate. And again, I'm not on his staff. I don't know what he's thinking about. I don't know if he'll reintroduce the same bill or modify it or come up with something entirely new for the 115th Congress. But I'm going to go through it because it's interesting. Okay, so the American Health Security Act of 2013, it expresses the sense of the Senate concerning one, enactment of a Medicare for all single-payer healthcare system, and that's very key. That some people seem to think Medicare for all is this thing and single-payer is this thing. They're the same thing. Medicare for all is the type of single-payer system that is preferred here in the United States. It's the single-payer system of choice in the United States. Canada has their own system. Great Britain, Scotland, and Australia have their own preferred system. In the United States, people seem to have the most support for Medicare for all. Basically, just taking the requirement for age 65 and turning that into zero. So from birth to death, from the cradle to the grave, everyone would have Medicare. That's the intention. And so number two, recognition of healthcare as a human right, which people have debated and kind of concluded that yes, it is a human right. State flexibility in designing healthcare programs, and so individual states will be able to streamline Medicare for all to fit their state needs. And then also for the goals of a new single-payer healthcare system efficiencies through integrated care and implementation of policies to ensure higher quality, better prevention, and lower capita costs. And so that's the intention of this bill. It establishes a state-based American healthcare security program to provide every United States resident with healthcare services, and it requires each participating state to establish a state health security program. It eliminates benefits under 1, Medicare, 2, Medicaid, and 3, Children's Health Insurance CHIP program of the Social Security Act, and then also FEHB and TRICARE. And so all these existing forms of healthcare services, the funding for that and the programming for that would be integrated under Medicare for all. Since everyone would be covered, everyone would be having the same system. It would be universal for us all. Everyone is in, no one is out. There's no need to separate out different populations for different types of healthcare programs. So U.S. Congress would have the same healthcare as us, the U.S. citizen. Children, people of a certain age, over 65, they would still be covered under the same program. So not separated out by age, by by age, and then also by employment, things like that. Everyone would have the same exact level of service. And so all that funding for those different TRICARE, FEHB, CHIP programs, Medicaid, that funding would come under Medicare for all. So there's already existing funding. All that funding that exists would go to Medicare for all to cover everyone. It repeals provisions of the Patient Protection and Affordable Care Act related to health insurance coverage, including provisions concerning state health insurance exchanges, and then requires each state health security program to prohibit the sale of health insurance in that state that duplicates benefits provided under the program. So for-profit health insurance organizations would not be allowed to participate in Medicare for all. They would be elective service. Medicare for all would be for preventative and for required care. Cosmetic surgery, elective services like that, that would be for the for-profit health insurance providers. They would not be allowed to duplicate any services like required or preventative care. Okay, so it establishes the American Health Security Standards Board to develop policies, procedures, guidelines, and requirements to carry out this act, and then establish uniform reporting requirements and quality performance standards. Provide for an American Health Security Advisory Council, and establish a national health security budget specifying the total federal and state expenditures to be made for covered healthcare services. And so there would be oversight. There would be regulation, administration, and oversight. Establishes the American Health Security Quality Council to review and evaluate practice guidelines, standards of quality performance measures, and medical review criteria, and develop minimum competence criteria. Creates the Center for American Health Security Innovation to accelerate the implementation of new modes of care that would improve patient care, improve population health, and lower costs. And so again, there would be some oversight, there would be administration, there would be regulation, there would be advisory boards. Establishes the Office of Primary Care and Prevention Research within the Office of the Director of the National Institute of Health, NIH. Creates the American Health Security Trust Fund and appropriates to it specified tax liabilities and current health program receipts, including premium assistance credit amounts under PPACA. And again, money that already exists would be folded into Medicare for All. And so premium credits, things like that would be folded into Medicare for All. Funding for Medicaid, existing Medicare, CHIP, TRICARE, FEHB, all that comes to Medicare for All. Let's see. Amends Internal Revenue Code to impose on individuals a health care income tax and an income tax surcharge on amounts of modified adjusted gross income exceeding $1 million. Imposes an excise tax on securities transactions and allows an income tax credit for such taxes. So there would be a tax on income, whether it's self-employment or payroll income, progressive tax, and then also income on adjusted gross income of people of $1 million or over. And then also an excise tax on securities, meaning like a Wall Street tax. And so that's what Bernie Sanders came up with 2 Congresses ago. He didn't run on it during his campaign for president. He seems to be running for 2018, I guess, on this. I don't know. He didn't tell me. And so I'm not sure what the intention is, but that's what we've seen in the past from Bernie Sanders. We can also see how that compares to what John Conyers is doing now. This is in the House. John Conyers has already introduced his bill. He's introduced it like every year since 2003. The longest serving member of the United States Congress has consistently put this into play through the Bush administration, through the Obama administration, and now through the Trump administration. Some people seem to think that John Conyers only introduced this during George Bush's administration and during Donald Trump's administration when he knew that the president would veto this. But that's not true. This has come up for consideration from John Conyers every year since 2003. And so that means underneath Barack Obama's administration too. So this is H.R. 676, Expanded and Improved Medicare for All Act, 115th Congress. That means it's currently in play for 2017-2018. Right now it's up to about 115 co-sponsors, which is the most that have co-sponsored this bill. A majority of the Democratic members of the U.S. House support this bill. Okay, so it's the Expanded and Improved Medicare for All Act. We're going to see how it compares to what Bernie Sanders introduced in the past and what he may introduce into the future in the Senate side. And those of you, you can also look at the links and compare and contrast and see how you think it might be reconciled if and when Bernie Sanders does introduce that famous bill that he's been talking about so much. Like I said, I think Bernie's gonna make us beg for it. I don't know what he's doing. Anyway, this is John Conyers. This bill establishes the Medicare for All program to provide all individuals residing in the United States and the U.S. territories with free health care that includes all medically necessary care, such as primary care and prevention, dietary and nutritional therapies, prescription drugs, emergency care, long-term care, mental health services, dental services, and vision care. Only public or nonprofit institutions may participate. Nonprofit health maintenance organizations, or HMOs that deliver care in their own facilities, may participate. Patients may choose from participating physicians and institutions. So there's universal access to physicians, universal access to hospitals and clinics, and that the patient can move across state lines under Medicare for All. You're always in the network. No matter what state you move to, you're always a part of Medicare for All. Health insurers may not sell health insurance that duplicates the benefits provided under this bill. And that's similar to Bernie Sanders. For-profit health insurance providers are not welcome. They do not duplicate services. They offer a supplemental service. Insurers may sell benefits that are not medically necessary, such as cosmetic surgery benefits. The bill sets forth methods to pay institutional providers and health professionals for services. Financial incentives between HMOs and physicians based on utilization are prohibited. The program is funded, 1, from existing sources of government revenues for healthcare, which is what the same thing that was outlined in Bernie Sanders' bill, very specifically, of which existing forms of government health care are folded in and then used to fund Medicare for All instead of Medicare for segments of the population. Everyone gets funded. 2, by increasing personal income taxes on the top 5% of income earners. 3, by instituting a progressive excise tax on payroll and self-employment income. 4, by instituting a tax on unearned income. And 5, by instituting a tax on stock and bond transactions. So very similar, again, to what Bernie Sanders has, but a little bit more specific about the types of taxes. And I know that there's some people who say, well, don't tell people that there's going to be a tax. Because then, some people just knee-jerk respond and say no to any raise in their taxes. And you know what? That's what the bill says. Both of the bills say that there will be a tax, and that is how it's funded. If you say, like, no, there's no tax, and they read like there is, then they think that you lied to them. So basically, this is what it says in the bill. And so when you're describing it to people, you can like play pretend if you feel like you have to do that in order to convince them, whoever you're talking to. But I believe in being forthright, and that is what the bill says, this one and that one. So anyway, people have different ways of communicating. I believe in being very forthright and direct. But anyway, by instituting a tax on unearned income, and then instituting a tax on stock and bond transactions. So Wall Street would help to fund Medicare for All. And it's the least they can do. Let's see. Amounts that would have been appropriated for federal public health care programs, including Medicare, Medicaid, and the Children's Health Insurance Program, are transferred and appropriated to carry out this bill. And then with Bernie Sanders, he also names off FEHB. That would be, the funding for that will come under here. And then also TRICARE will come under here. The program must give employment transition benefits and first priority and retraining and job placement to individuals whose jobs are eliminated due to reduced clerical and administrative work under this bill. And so the people who are currently in the healthcare insurance industry, they do the billing, they do the administrative work, they would be retrained under a different employer, the United States government. Instead of working for Blue Cross and Blue Shield and Aetna and what have you, they would work for the U.S. government. And that would be where they would get their paycheck. And they would be retrained, likely doing similar things. And if we remember, under Bernie Sanders' bill, there's quite a lot of regulatory agencies or organizations that would be needed to oversee Medicare for All. And then under this too, John Conyers, the Department of Health and Human Services must create a confidential electronic patient record system. That might cause concern on privacy issues. The bill establishes a National Board of Universal Quality and Access to provide advice on quality, access, and affordability. And I think that's somewhat of a statement of regulation, advisory, things like that. Bernie Sanders seemed to have a lot more regulation outlined, and that might be who absorbed the refugees from the for-profit insurance industry, the people who would be transitioning their jobs. The Indian Health Service must be integrated into the program after 5 years. So yet another health program with existing funding that will be used to fund Medicare for All. Everybody would have the same access. Everyone would be part of the same program. It would be universal. There would be a single payer, Medicare for All. Congress must evaluate the continued independence of Department of Veterans Affairs health programs. And so possibly Veterans Affairs might be folded into Medicare for All, since everyone would have the same type of health care access. There would be no need to have a separate department, maybe. That would be further into the future. Congress would decide that, it looks like. And so that's John Conyers' bill and how it compares to what Bernie Sanders came up with two Congresses ago in 2013, and possibly what he might reintroduce. It might be modified. We don't know. I'm waiting for him to email me all his secrets and tell me. I might be waiting a long time. But anyway, that's just discussion to roll over in our minds and think about the joy that we can have when we can at last have not only a public discussion on HR 676. Paul Ryan feels like being a man and introducing it. And then also in the Senate, on the Senate side, if we could see an introduction of the bill and then it brought to the floor and then public hearings on Bernie Sanders' bill. Again, we might have to beg him for it. He might. I think Bernie wants us to beg him. I think that's what he wants to do. I don't know. But anyway, I'll post those links in the description and you can see for yourself what you think. Good luck.